Hey everyone, and welcome to our consult room. My name is Dr. Roy, board certified facial plastic surgeon, one of the new members here at Refined MD. One of the big reasons that we decided to change our name from Refined Dermatology to Refined MD was that we wanted to bring in a multi-specialty approach to patients in terms of aging face. Not only are we experts in skincare, resurfacing treatments and injectables, but we're also now starting to expand to the realm of facial plastic surgery. And I'm just really glad to be here. We've done some amazing stuff that we can't wait to show you and discuss with you in the next few minutes, as well as this evening. So let me tell you a little bit about myself. 100% of what I do is facial plastic surgery, okay? I don't do any body, and it's not because I don't like the body, it's just that I really find a great interest in facial anatomy, and I just think that whole area is just fascinating, and I think patients find a sense of comfort knowing that that's all I do, okay? And so what are the common things that I do here? So I told you a little bit about that transition from aesthetic dermatology to going into surgery. So what does that mean? So I'm seeing a lot of patients that maybe have long-standing issues with skin laxity, ptotic tissues or kind of droopy tissues in the lower face and neck. They've tried other things, non-surgical treatments that probably resulted in some fair outcomes, but they were looking for something a little bit more definitive, or maybe a little bit more long-term. And so one of the major components of my practice is facelifting, neck lifting, and eyelid rejuvenation. So I do a fair amount of limited incision or mini facelifts, full lower facelifts, which also include the neck. So it's like having a facelift and a neck lift. And also a lot of eyelid rejuvenation in terms of upper blepharoplasty or upper eyelid lifts, lower blepharoplasty, which is basically a procedure to remove fatty deposits underneath the eye. We also do a fair amount of brow lifting and earlobe reductions and ear pinning. So there's a lot of things that we do. Another great interest of mine is rhinoplasty, and I just wanted to quickly feature a program that I think is really unique. It's called Vector 3D. It allows me to take a few pictures of patients, simulate a 3D image of their face, and then basically play around with it to show them what we might be able to accomplish through surgery. It's obviously just a communication tool. It's not a 100% guarantee of result, but we do our best to get to as close to the simulation as possible. So, I'm just using this patient as an example. You can see that we can do such really cool things like, removing a hump, for instance, right? So what would that look like? Kind of like that. How about if I wanted a little bit more rotation in my tip? Well, that's easy. I can just do that. And you can see that just through these small changes, we can communicate, what it might be like to have a rhinoplasty. People think about this for a long period of time. A lot of people come in for injectable fillers or liquid rhinoplasties to kind of shop the results of a rhinoplasty. But it's really nice to be able to also then transition from that to, hey, look, we can do this on a more permanent basis through an actual surgical rhinoplasty. So I hope that was informative. Know that we do a lot of procedures here in the office. Everyone's asking me, okay, so well, do I have to go to a surgical center? No, you absolutely don't. We have a beautiful procedure room here in the office, which hopefully you get to see in this video. And we perform a wide variety of facial plastic surgery here, including mini lifts, neck lifts, and upper blepharoplasties. Those are probably the most common things that I perform here. Please avail of any specials that might be available from a surgical standpoint. I'd be happy to see you in consultation and see if you're a great candidate for facial plastic surgery. And I appreciate your time. I hope the champagne's good. My name is Sudeep Roy. I am a facial plastic surgeon. I am actually double board certified in facial plastic surgery, so I had to go through 2 board examinations to get there. Why am I here? Because really I did my undergrad at Stanford, had a lot of friends around the area, so I convinced my wife to move to the area. But I otherwise did my medical training in New York. I did a pretty rigorous surgical training in Philadelphia in head and neck surgery. And then I went over to Austin to do a 1-year fellowship in aesthetic facial plastic surgery, where I was basically doing facelifts the whole year. From a guy named Ed Buchan. Sorry, I thought there was a question. My practice, so I've been in private practice since coming out of fellowship, and my practice is a great resource to learn about what I do. I post a lot of befores and afters, recovery things that you might find useful, and a little bit about me, because I think it's important to know. I don't know how many of you are established patients of the practice, but you know we were called refined dermatology, and now it's refined MD. The reason for that is because we're offering a lot more than just aesthetic dermatology, right? So we have facial plastic surgery, body contouring. Dr. Ye's, the newest certified dermatologist, has joined the practice, and so we're doing a lot of laser resurfacing, phototherapy with PBLs and IPLs, as well as heat-based skin tightening. And you'll see why this. Count to 3. 1, 2, 3. 1, 2, 3. Sorry. And 1, 2, 3. Okay. We're good. That's it. This part takes a little bit as it's stitching the 3 images together to create a 3D simulation. So,
oh, that's cool.
So that, basically created a 3D image of Liz's face. You can spin it around. Right? And then there's 3 modules. There's rhinoplasty, chin augmentation, and then just general contouring stuff. I use this software a lot for rhinoplasty modulations and simulations, but I also find them pretty useful for chin augmentation. So this is basically a few points that get assigned to the image, so that then we can alter them using a set of predetermined. So now I'm going to go into the chin augmentation analysis mode. It's usually in the lateral view. Before I do that, actually, what I'm going to do is I'm going to orient her appropriately. So this is usually the orientation that we use to analyze chin projection as well as the nose. And now I'm going to start doing the simulation. In this case, you can see that basically, this is a lateral view of Liz's face, and you can kind of notice that the chin is a little receded there, right? So basically what this model allows me to do is basically simulate what a chin implant might look like, right? My practice is built on consistent and standardized before and after images used to demonstrate results from a wide variety of procedures I perform. I have a dedicated photo room, which allows me to keep factors such as lighting, background, camera settings, and angles consistent between images. Patients are encouraged to have a similar level of makeup, eyeliner, and lipstick for their before and after photos. Large earrings are also removed for best inspection of the area around the earlobes. Photographs demonstrating natural and rejuvenated results without the telltale signs of plastic surgery are critical to prospective patients in deciding which plastic surgeon to move forward with. I typically take after pictures around the 6 and 12 week mark, as I feel most patients are sufficiently healed by this time. As most of you are aware, I highlight many new before and after pictures on social media and on the website, and I generally post these sequentially as they come in and are appropriately cropped for production. I have too many favorite procedures to pick just one, but I must say total facial rejuvenation cases, including a combination of procedures like facelift, eyelids, and fat transfer, really energize me. There is very little editing that is required on my photographs because of the consistency in the manner they are taken. All we really have to do is crop the images and line them up side by side. Most patients are comfortable sharing their before and after photographs, although each and every patient is asked for their explicit permission before doing so. A variety of options exist to share your photographs, which gets discussed at the 6-week appointment. Patients often refer to before and after photographs they've seen on our website or social media accounts as an example of what they're looking for, and together we discussed realistic expectations.
In my spare time, when I'm not at work, I'm doing other sorts of work. I really like to work out. Hey, Sean, Put your legs up. Ready? Here we go.
Wee! Oh.
I also really like to cook.
My turn. Thank you. And of course, I love to read a good book.
Yeah. Ah, yeah.